Good evening, everyone. Myself, I'm Dr. Saujanya, Center Manager, Mom IVF and Research Center. With Mom IVF and Research Center has been started 5 years ago by Dr. Harikant sir and our Chief Fertility Consultant, Dr. Purnima Durga ma'am, with the chief motto to make fertility treatments available to all the people. They have started this with chief motto to do fertility treatments with an affordable cost. This month, January, being a cervical cancer awareness month, our chief fertility consultant, Dr. Purnima Durga ma'am, wants to give her insights on cervical health. I welcome her to give her insights in this webinar. Thank you.
Good evening, everyone. Am I audible to all? Yes? Can anybody give me a feedback?
Yes, ma'am.
Okay.
You
So,
are audible, ma'am.
yeah, thank you. So, good evening, each and everyone. Thank you so much for taking your time and joining this webinar today, which is a very important topic about how to I'll mute everyone. Yeah. So it's a very important topic about cervical health matters. And you all know that cervical cancer is the third most common gynecological cancer and one of the cancer which can be prevented and if can screened early can prevent going into a cancerous condition. So this is basically for everyone, not only for doctors, it's for common public as well to understand uh, how we can monitor ourselves from preventing this condition and also how we can prevent cervical cancer and what are the options available for us. So I'll be sharing my presentation. Can you see the screen? Yeah.
Yes.
Yeah.
Yes, we can see.
Yeah. Thank you. Okay. So the webinar for today is I want the webinar to be more interactive. We'll have the Q&A sessions at the end of the webinar. So the main motto of this is understanding cervical health, how to prevent it, how to screen it, and how if you have a precancerous condition or the cancer, how to detect it early and go for treatment early. So you don't need to cure cancer if you can prevent it, right? How many of you agree with it, right? If you can able to prevent it, why do we need to cure cancer? So cervical cancer is one of the most common cancer which has a prevention with a simple vaccination. You can prevent cancer by as high as 90 to 95% of the cancer cases can be prevented by simple vaccination. So in India, every nine minutes, a woman is losing her battle to cervical cancer, which is a very preventable condition. Okay, so which should not be happen to anybody in our family, right? Not neither you nor your relatives, not anyone in the family. We don't want anybody in our family to lose their life to cervical cancer, which is the most preventable form of cancer. So when you take about the Indian burden, how much India is contributing to the overall burden of cervical cancer, when you see the incidence, the rest of the world incidence is 77%. In India, it is 23%. See how much high number of incidents of cases are there in India, which can be easily screened. This is one of the cancer which can be screened easily. And the mortality rates, India is contributing 25% of the mortality rates and the overall mortality rate throughout the world. So such a high disease burden of cervical cancer there is there in the India, which can be eradicated by simple awareness. Today, it is our everybody's duty to understand it. And if you have your daughters or young children, or even in the reproductive age group also, you can get vaccinated and prevented from getting a cervical cancer. So basically, just a brief about female reproductive tract. We all know that you have a uterus, you have two ovaries where ovulation happens, and the fallopian tubes. Cervix is the entrance where the uterus entrance. We call it as where from where the sperm goes up and fuses with the egg and forms a baby. So this is the mouth of the uterus is called the cervix. You can say it as a mouth of the uterus, and this is a vagina. So you have vulva, vagina, cervix, uterus, fallopian tubes, and ovaries. So we are talking about this, the cervix, the mouth of the uterus. How can you screen it and how can you manage the condition? So basically, what causes cervical cancer? Who are more prone to cervical cancer? So the most common reason for cervical cancer is human papilloma virus. It is a viral infection which causes changes in the cervical cells and causes cancer, and it is a sexually transmitted disease. HPV is a sexually transmitted disease. So basically, the interesting fact is about 80% of the women will be infected with HPV in their lifetime. That means whoever woman is sexually active, the 80% of them will at some point in their life will be infected with HPV, human papilloma virus. But there are several strains of HPV virus. Only few are pathogenic. Not all strains of HPV virus are pathogenic, and that doesn't mean that all women got infected with HPV will have a cancer. So there are only few certain strains which are carcinogenic. We will be understanding in the coming slides. So this is basically the structure of a HPV virus. As I told you, not all HPV strains are carcinogenic. There are few strains which are carcinogenic, especially the high-risk group of HPV cancer-causing strains are HPV 16, 18, 31, 33. These are the most common high-risk viruses causing cervical cancer. Most of 75% of the cervical cancer is caused by HPV 16 and 18. And there are also some non-cancerous causes like low risk group where 6 and 11, these generally cause anogenital warts. They doesn't lead to cancer, but 90% of the people who have the infection with HPV 6 and 11 may have anogenital warts. So that is the reason the vaccine should also be a multivalent HPV vaccine which can cover all the 4 strains. We have a quadrivalent vaccine where 16, 18, 31, 33 are covered. So these are the most common strains. So, and the other important fact is like HPV vaccine doesn't only cause cervical cancer. There is 100% attribution to HPV infection to cervical cancer. But apart from that, HPV infection can also lead to another genital cancers like vaginal cancers, vulval cancers, people who are having oral sex that can lead to oropharyngeal cancers as well. Male can get penile cancer, so and also has a anal intercourse, they can have a risk of anal cancer as well. So the overall health risk of HPV is beyond cervical cancer, and we all know that vaccination should be given to both girls and boys, not only girls now. For boys also, it is a mandatory to get a HPV vaccination where it can prevent penile cancer in the boys. So who are the women who are at risk of HPV infection? Who are sexually active, who have more than one partner, whose partner has more than one sexual partner. Mostly it is a sexually transmitted disease. So it is very important to have safe sex practices to prevent this infection, and who already have other sexually transmitted diseases, who don't have regular pap smear tests, and women who are having immune deficiencies or having immunological problems, or who are on steroid injections, transplants, HIV, where you are immunologically deficient. That is the reason diet also plays a very significant role in improving your cervical health. You should have a healthy diet to maintain your immunity well, and also smoking. Smoking is also a risk factor for women to get HPV infection. And when you see see that whoever is infected with HPV infection, that doesn't mean that they end up with having a cancer. So when you take about the HPV infection, if you get an infection, the carcinoma is after 20 years. The virus is there in your body, in your genital region. So later, after so many years or 20 years, it is converting into an invasive cancer. So you have this much time to screen. So screening plays a very important role. It's not that you're getting with HPV infection and getting carcinoma the next year. There is a long incubation period for the virus to become malignant. So screening plays a very important role in this condition. So that's the reason you should get your regular pap smear test done. Right. So how do I reduce my risk of getting HPV? A lot of people ask this common question. What can I do? It's very important to have your sexual activity at correct time, delay the onset of sexual activity when you're at appropriate time, know your sexual partner. It's very important to have a single sexual partner where do not smoke, maintain a healthy diet and lifestyle, which I told you, and practice safe sex practices are very, very important. As you all know, it is the sexually transmitted disease, right? So basically, I'm talking about PAP. What is a PAP test? PAP test is a very simple test. This test collects cells from the surface of the cervix and looks for if there are any abnormal cells are there in the cervix. Abnormal cells can be treated before it develops into a cervical cancer. That means if you're not having abnormal cells, that doesn't mean that they are cancerous. You can treat that cells from progressing to malignancy. So it is a simple test which tests the cells of the cervix. When cancer is detected early also, it is easier to treat. When you look at the prognosis, the 5-year prognosis of a cervical cancer, when it is detected at the early stage, the survival rate is as high as 90%. But if you when you take about the 5-year survival rate in the advanced cancer, it is 17%. So it's very important to identify it early, get it treated, where you have a very good 5-year survival rate after the treatment. So there are few prerequisites before going for PAP test. There should be no douching or using of any vaginal lubricants or medications or spermicides whenever you're going for the PAP. You should basically you should schedule a PAP smear test mostly after your periods are over, after your menstrual cycle is done, and abstain from intercourse 1 to 2 days prior to giving the smear. These are the few prerequisites which you need to consider before going for a pap smear test. This is basically the cervix, the mouth of the uterus, which I told you in the diagram. So this is a pap smear. How you take this brush and smear through it so that you collect the cervical cells and send for test. So this is how the cervix looks like. And you keep it on the slide and you look for the normal and abnormal cells. This is how the slide looks like. So basically, next question is how frequently should I have to have my pap smear test done? So basically, there are clear guidelines about pap smear test. The first pap smear test is whenever you are entering into the sexual activity. Once you have a sexual activity, you start doing your pap smear test. So initially, till the age of 30, it is recommended to do your pap smear every 2 to 3 years. So basically, after that, if the consecutive pap smear tests are negative, then you can increase the frequency to 5 years. So basically, as you know, with pap smear test, the number of women with cervical cancer has decreased dramatically, and you can see the changes in the cervix very early, where they are still precancerous and can be managed with from preventing. You can always prevent the patient going into a carcinogenic condition, and this can be done by simple routine screening. Pap smear is a very simple test. It is not at all painful also, and you don't need any anesthesia or any sort of thing. It can be done in the doctor's OPD and a very simple test. So what are the symptoms of cervical cancer? When you have to suspect that you are having something, some cervical cancer. One is abnormal bleeding. Abnormal bleeding can be either postcoital after you have your intercourse, or in between periods, or after menopause. That means you have completed your periods and again you are starting bleeding. Postmenopausal bleeding is something which you should never be ignored, and you should get evaluated. And whenever you have unusual vaginal discharge and any other symptoms, like these are all vague symptoms like pain, vague pelvic pains, bleeding from the rectum or bladder, or some patients may not have any symptoms. So that's the reason screening is very, very important. So these are some pictures of how cervical cancer looks like. It's a silent killer. So we understood now how to screen the patient. Screening is mostly, as I told you, is through pap smear test, and I clearly mentioned that how frequently you have to get your pap smears done. So now comes the prevention, which this is the only gynecological cancer which can be prevented by simple vaccination. Vaccination, HPV vaccine, human papillomavirus vaccine is the key for cancer prevention. It is a very safe vaccine, very highly effective. It is as effective as 100% in preventing cervical peak pre-cancer and cancerous condition. So, when you take about the graph of this, so primary prevention vaccination comes under primary prevention, screening comes under the secondary prevention. Just one second. Okay. So screening comes under secondary prevention and treatment of precancerous condition. Then comes the cancer treatment, and in the advanced cases, palliative treatment. So why vaccination is important? In natural infection, you get weak antibody response. When we give vaccination, there is a high antibody response, high antibody level at the cervical epithelium prevents the HPV infection. When to be given? This is the most common question a lot of people ask, and it is very important. Today's webinar is all about how to screening when, how often, and prevention, which is mainly through vaccination. Vaccination should be given to both boys and girls. It starts from boys and girls of 9 to 12 years age, and in females, vaccination can be given between 9 to 45 years of age group. And the dose is like 3 doses you have to give over a period of 6 months, 0 to 6. You have 2 types of vaccine. You have Cervarix and Gardasil. Cervarix is a bivalent vaccine. Gardasil is quadrivalent, which is containing the 4 strains. But now, of late, there is a research which is going on where you are getting a single dose, because what happens with 3-dose vaccine is some people are missing the 3rd dose, which is very, very important. So don't forget your third poke. So now they are developing a vaccine where with single poke, especially in the young boys and girls, which is giving maximum antibody response. Future, I think you'll get a single shot vaccine for all the young boys and girls. So it's very important to show your arm against cancer. Let's all show our arm against cancer by getting vaccinated with HPV vaccine. So another common question asked by everyone is, it is worth vaccinating sexually active women? Yes, it is worth vaccinating sexually active women also, even though the protection might not be 100%, like how in the adolescent boys and girls before attaining sexual activity taking the vaccine. But sexually active women can get their pap smear test done. Once the pap smear is normal, you can get your 3 doses of HPV vaccine. You still get 90% protection in these women as well. So you can see here how to keep your cervix cancer free. First, it's always better to get your boys and girls, your children, daughter and sons, to get vaccinated at the age of 11 to 12 years, 3 shots over a period of 6 months. First pap smear, this is the prevention which we are talking about. Then comes the screening of cervical cancer, where the first screen is whenever you started your sexual activity, that is around 21 years, get your first pap test at 21 years. From then on, get one every 3 years. And after that, once if 3 consecutive pap smears are negative, you can increase the interval to every 5 years. So, according to ASRM, till how long we have to screen? So, basically, according to ASRM and ESHRE guidelines, they say that till the age of 70 years, you have to get your pap smear test screens. But after 45 years, you can increase the screening to every 5 years. So, to summarize, 27% of the world burden of cervical cancer is seen in India. Cervical cancer is caused by simple human papillomavirus, which can be easily prevented by taking a cervical cancer vaccine. It is usually diagnosed in late stages in India. There comes the role of screening, which is very important. Screening is recommended in all sexually active women of more than 30 years by WHO. Vaccination is recommended. Age group is around 9 to 45 years or 10 to 45 years. Vaccine efficacy is almost 100%, 98 to 100%. No screening is required for unmarried girls before vaccination, but the women, as I told you, who are sexually active should get their pap smear test done and then go for vaccination. See and treat approach is good cost-effective option for secondary prevention. So it's our duty to protect our daughters, sisters, mothers, and everyone against this deadly disease, and let us all make Bharat a cervical cancer Mukt Bharat. It is all in our hands. It is one of the common cancer which can be easily prevented by taking a simple vaccine and a regular screening program. So I felt this video very nice.
In India, every 7 minutes, one woman is dying of cervical cancer. How would you, as Femina Miss India 2024, inspire women across India to prioritize their health and raise awareness about cervical cancer prevention?
Ma'am, I feel we are the country which believes in God's plan versus your plan, and we tend to give privilege to the God's plan more. And whenever a disease like cancer or something happens to us, we tend to believe that it is because of the destiny. But I always believe that it's the prevention which is better than cure. And if taken care of it at the right time, I think we can tackle the situation and with the proper awareness, because I also believe that it's the word cervix in the cervical cancer which is making it a taboo and not making us talk about it more. We should talk about it more. We should talk about women's reproductive system more in order to be more aware. Thank you.
Thank you very much.
I really felt very nice when that girl, that lady is talking about it. She clearly mentioned about few words. One is prevention, awareness, and also cervix, which is a taboo topic. And we should all talk about reproductive health. We should get educated about it and be aware of it, and let us all make India a cervical cancer-free Mukt Bharat. So thank you all for your patient listening, and now I can take some questions. So if you have any queries, please type it in the chat box. So I'll be answering your questions. Now I'll just stop sharing the screen. So yeah. So someone asked, after finishing treatment, how soon should a patient try for baby and what should they monitor? So basically, a lot of people see, we are into fertility. So mostly our patients are in the reproductive age group who come to us. So whoever is suffering from any malignancy, the minimum period for them to recover and get back or to regain the fertility is minimum 6 to 12 months. But definitely it also depends upon the stage of the cancer. If cervical cancer, if you take for example, cervical cancer, if it is diagnosed early at stage 1, we can retain the uterus and there is no need of chemo or radiotherapy. It can be simply managed by simple surgery or cutting the malignancy at that point. That is called a simple conization or tracheolectomy, or just removing that part of the cancer. In these cases, wherever you're not using chemo or radiotherapy, the fertility is retained. So it's very important at what stage the cancer is diagnosed and what treatment the patient got offered to. The minimum is at least 1 year after finishing the treatment. So, yeah, does HIV positive women have higher risk of developing cervical cancer? As I told you, any immunocompromised patients comparative to normal patients have a very high risk of developing cervical cancer. So, can a patient still use their own eggs for IVF after undergoing cervical cancer treatment, or would they need to consider egg donation? Very important question. It again depends on the stage of the cancer, what type of treatment we have the patient took, whether it is only a surgery or there is a chemotherapy or radiotherapy involved. We all know that chemotherapy and radiotherapy damages your normal cells as well a bit, especially fertility is affected whenever you're taking a chemo and radiotherapy. For these patients, there is a very nice option of fertility preservation where, and also apart from the fertility, the quality of the oocytes or the sperm, whatever type of cancer will be affected, and the quality will also be coming down in this patient. So they have an option of fertility preservation where you can freeze their eggs before going for the treatment. This is only possible in very early stage of cervical cancer where you have certain time before treatment. In these patients, you can definitely think of an option of fertility preservation, which is, in these cases, definitely, yes, they can use their own eggs. Otherwise, after chemo and radio, mostly patients go for egg donation where they call it, because that damages their fertility and also the egg count and quality. So if you want to have your own eggs, you can think about the option of fertility preservation before treatment. Someone asked, how do treatments like surgery or radiation for cervical cancer affect a patient's ability to get pregnant later? As I told you, see, it depends on the stage of the cancer and what treatment you are offering. They are fertility sparing surgeries, but that can be offered only in very early stage of cervical cancer, stage 1 and 1A and 1-2, where you are just removing the local lesion. So there is still uterus which is retained, so they can plan their pregnancy. But whenever you are using radiation or chemotherapy, the quality of the egg and the number of egg count will be affected, and the chances of getting pregnant might be slightly less. So it definitely depends upon the stage of the cancer, age of the patient, treatment plan, and as I told you, fertility preservation option is always there for these patients. So someone asked to share the video again. We'll do it. Can a patient still use, can women older than 50 get this vaccination? Basically, after 50, the vaccine effect is not that much. So it is very clearly given in the guidelines that the age 9 to 45 is the age where they can benefit with HPV vaccination, because after 45, you are already infected with it. At that stage, you might not able to prevent it. At that point, screening plays a very important role. Identification of the cancerous condition early plays a very important role than prevention at that stage. Someone, what fertility preservation option should patient consider before starting cervical cancer treatment? As I told you, freezing their eggs. If she's married, she can go for embryo freezing. If she's having a partner, she can use the sperm and make the embryos and freeze the embryos. If she's unmarried, then definitely she can think about freezing her eggs. Are there any side effects? No. Can IVF patients who have had hysterectomy or other major cervical cancer surgery to have children, yes. See, in IVF also you have surrogacy, where if the hysterectomy, obviously your uterus is removed. But if you are preserving your eggs before, you can have your own biological child with your own eggs and transfer into a surrogate. Someone asked about PCOD problem. We are going to discuss it in the next session. Okay. So we are going to just share the video. Someone is requesting again to share the video. I'll just share the video once again.
In India, every 7 minutes, one woman is dying of cervical cancer. How would you, as Femina Miss India 2024, inspire women across India to prioritize their health and raise awareness about cervical cancer prevention?
Ma'am, I feel we are the country which believes in God's plan versus your plan, and we tend to give privilege to the God's plan more. And whenever a disease like cancer or something happens to us, we tend to believe that it is because of the destiny. But I always believe that it's the prevention which is better than cure. And if taken care of it at the right time, I think we can tackle the situation and with the proper awareness, because I also believe that it's the word cervix in the cervical cancer which is making it a taboo and not making us talk about it more. We should talk about it more. We should talk about women's reproductive system more in order to be more aware. Thank you.
Thank you very much.
So someone asked me, how would I know your sessions, ma'am? So we will be posting it in the social media platforms. So definitely it's all in the social media. We'll be posting our next webinar. And someone is asking about, do you have egg preservation at your place? Yes, definitely. Egg preservation is something, fertility preservation is now coming up as a previously the egg preservation is not that great, but now with the advanced techniques, the egg preservation has become a most common procedure which we are doing in our IVF lab. Egg preservation, there are two indications. One in cancer patients, that is called oncofertility, where we preserve their egg or sperm before going for any oncological treatment, either surgery, chemo, or radio. And now we are also doing for social egg freezing, where women who want to delay their conception for whatever reasons, we are freezing their egg at early age. And also there are certain conditions like endometriosis, which are reducing their egg count and quality. In these people also we are offering egg freezing. So we do have that service here at Mom IVF. So thank you. Thank you all for joining this webinar today. Hope this session is helpful for all of you. So hope we continue to do more such sessions, more such awareness programs and webinars from our side. Thank you. Any more questions? Thank you. Thank you. Thank you so much. Any more questions? So we'll be winding the session in 2-3 minutes. Thank you so much. Thank you. Thank you. Thank you, everyone.